Got it. My name is Ron Werft again. I'm the CEO of Cottage Health, and I've been there for a long time, but we've been talking in recent years with all of our construction about Cottage Extreme Makeover, and I would say that this is part of Cottage Extreme Makeover. It's really modifying our mission statement, starting with our board. We're a not-for-profit organization. We're led by a volunteer board. And we've made a commitment to getting outside the walls of our hospital and trying to really do a very good job of understanding the data around healthcare disparities in our community. And what role can Cottage play, certainly not by ourselves, but what role can we play in partnership with educational institutions, with our schools, with the university, with City College, with other healthcare providers, with Santa Barbara neighborhood clinics, with VNA, with Food Bank, to really get at what we know are disparities in every community, but it certainly exists here, we know. Right now we're doing a community health needs assessment, which we've done every 2 or 3 years for many years, but with the recruitment of a team that really knows how to do this, we're doing it so much better. These are telephone surveys that are going down not just to zip code level, but to actually to cross street, and we're oversampling our low-income population in our communities. And so that's going to give us a lot of data that we will use then and make available to everyone to really drive interventions that we think will make a difference in health status of our community. The schools are going to be key partners for us in this. This is where the kids are, and frankly, it's where the families are. And we have relationships with a number of the schools in the community, including, of course, City College, UCSB, Cal State. But we see real opportunity for partnerships with the schools frankly, throughout the county in addressing the findings that we come up with here. So I get asked a lot, what is population health? We're used to taking care of providing patient health. So people who come to us with traumatic injuries or illnesses, we have physicians and nurses who take care of them. This is really taking it up to understanding, are there issues around childhood obesity among young Latinos? Yes, we know that. But let's understand really more about that and how can we get that. Are there discrepancies in terms of immunization rates? Are there discrepancies in other aspects where, with the proper interventions, we can raise the health status of our community? I think part of this is just consistent with our not-for-profit mission and trying to really use what resources we have to work with others, including other foundations, I'll say, to make a difference. It's also consistent with where healthcare is going in general, which is we're going to see a migration, I hope, fairly soon, from fee-for-service to more taking care of populations of people. So if we can learn how to do a better job with patients who are on Medi-Cal or uninsured or live in certain neighborhoods, we partner with the Santa Barbara neighborhood clinics already, we're going to be better able to also, I think, do something about the rising cost of healthcare in our community as well. So those are the motivations around this, and we've done a number of what we call listening tours. We started inside the walls of the hospital with our own employees. We learned a lot from that with our physicians. And we have this session today, we have another session tonight, we have one tomorrow at noon, tomorrow evening in Santa Ynez, and it's an opportunity for us to really, we're going to step back from this after we they serve lunch and we have a chance for a little conversation. And Bob McKinnon who is here to facilitate this, will be, along with Allison, will be kind of asking some probing questions of you. And really, we're taping this, as you can tell. This is leading up to an event. Most importantly, we're just going to get good information. But a second purpose of this is that we're going to be putting on a population health symposium in April of next year that we're going to have. It's going to be very large with a lot of leaders in our community will be involved in this, and we'll be using that to try to move this forward. Exactly what should we be tackling? How can we do it together? And what kinds of partnerships might come out of this? So you had a chance to meet Monica and Maddie, who are both, Monica's been with Cottage for a while, but new to population health, and is running all of our community benefit programs now. And I don't want to take too much time to go into that, but Cottage does more than most people think in our community already. We spend about $2 million a year on funding grants to support other nonprofits that are making a difference outside of the walls of the hospital. And Monica does a really good job of managing that program for us. And Maddie is relatively new to Cottage, and her expertise is in evaluation. And she's the Director of Population Health Evaluation. And we feel that there have been a number of efforts in Santa Barbara to tackle community problems like this. Our intention is to do a really good job of evaluating the interventions that we do. And if they're working, do more of that. And if they're not, go in a different direction. So I think Maddie's expertise is going to help us quite a bit. Unfortunately, Elizabeth Majestic is not here. She's our Vice President for Population Health, and I'm sure you'll have a chance to meet her. She was at the CDC for 23 years before coming to Santa Barbara. She has great expertise in this area. She had a family emergency literally early this morning and had to leave the community to take care of that. So you'll have a chance to meet her in the future. But again, I know that this is probably the worst time of the year. We could have invited you to do this with all that's on your plate right now. So I really appreciate you taking the time. And they're going to serve lunch in a moment. And I think once the plates are served here, we'll probably go ahead and get started. So do you have any questions about kind of what we're up to here? Again, just really appreciate your time.
Thank you.
Great. All right.